Now, as South Africans await the arrival of 1 million vaccines, we ask what we can expect once we are vaccinated. Joining me now is Professor Theresa Rossouw, who is Associate Professor for Family Medicine and Medical Immunology at the University of Pretoria. A very good afternoon to you, Prof, and thank you so much for your time. Talk us through perhaps the process of vaccination and I guess the fact that it actually is voluntary.
Yes, absolutely. So the process of vaccination is that the vaccine contains a tiny portion of the virus that's not able to make you ill, but it's enough to stimulate your immune system so that it can generate antibodies that will protect you against the virus when you are exposed in the real world. So this, of course, takes time. We know these immune responses take at least 7 to 10 days to be elicited in the body. And then a single dose is usually not enough to give sufficient protection. So that is the reason for the second dose that's given any time about 4 to 12 weeks after the first dose. And after that time, we hope that we will see immune protection in the majority of people who have been vaccinated. So, of course, there are a lot of misunderstandings, a lot of fear about the vaccines, and this has caused some people to be hesitant. But we are confident that the vaccines are safe. They've gone through sufficient safety testing, although we're still learning a lot about the new variant and how effective it will be. But vaccination is voluntary. It's always voluntary. So I think we need to empower people with knowledge so that we take some of the misconceptions and some of those fears away.
Professor, some of the material that I've been looking at says when trials are being made for the efficacy of vaccines, that it usually takes a period of about 2 years, 24 months or so, to actually see what the real after effects of a particular vaccine will be on the body. Could you comment on that?
We have to distinguish between short-term and long-term effects. So vaccines have a very good safety record. Normally, if we're going to see complications that are very evident early on in the process. So after a few weeks or months, we will see if there are problems. So vaccines have a long track record. The vaccines that we are getting are using slightly new technology. So for that reason, they will be monitoring in the long run to see that there are not any specific long-term consequences. But we have no reason to expect that there will be anything that will definitely change the way that your immune system works or causes damage to your DNA or some of the rumors that have been going around.
You mentioned there, Professor, about the fact that the dosage will have to be in 2 phases. How immune or how safe is an individual after they've taken the first dose? Does it mean that they are then already immune to the virus?
Unfortunately not. So no vaccine is 100% effective. And even after the second dose, we can't assume that everybody is immune. So what we know from the AstraZeneca data that have been published is after the first dose, you are about 60% protected. And then depending on the dosage structure that they give, you can be between 70 and 90% protected after the second dose. Having said that, we don't yet know how effective this vaccine will be against the new variant that's circulating in South Africa. We are, of course, very hopeful that it will be effective, but it might be slightly less effective. What we should remember is that we also know the vaccine protects against severe disease. So even if you should become infected with COVID, we do anticipate that you will not get as ill as you would get if you had not had the vaccine.
Now, Professor, upon arrival of the vaccines, they will have to go through a 10 to 14-day test where, it has to be tested for efficacy in South Africa. What needs to be assured during that testing period to ensure that the integrity of the vaccine is not compromised and the strength of the vaccine is not compromised?
So fortunately, this is a very robust vaccine. So it's not very temperature sensitive, but of course, they will make sure that the vaccine is stored at correct temperatures, transported in trucks that are also at the correct temperature. But they will not be doing any efficacy testing. They will only look to see that the concentration and the ingredients are correct. So for us to look at efficacy testing, that will mean much larger scale clinical trials where we look at the new variant. So that is not what will be done here. We have had the phase 2 study of the vaccine in South Africa, so we know that there were no specific safety issues in our population. We know that it was effective if given at a half dose, full dose strategy. So we don't have to test for efficacy again. Although, as I say, the new variant is still something that we need to consider further.
Wow. So basically, all 1 million of the doses will be analyzed to, in fact, make sure that what is in there is exactly what we are expecting. Is that what you say?
No, not all of them. A sample of them are tested. So they take a representative sample, make sure that they contain what is on the label. And that is what this whole process is all about. It takes about 2 weeks, and it's just to make sure that the South African population is not exposed to something that has not been tested. So it's a very necessary step of the process.
Well, Professor Rossouw, thank you so much for your time and for giving us a little bit more information as to what exactly will be happening once the vaccines actually arrive in South Africa. That's Professor Theresa Rossouw there. She's Associate Professor for Family Medicine and Medical Immunology at the University of Pretoria.